Hi everyone, and welcome to Module 4. Now, throughout the semester, we've talked about why we punish people, what happens during incarceration, and the challenges that offenders face when they're returning to the community. And you've definitely seen that no two offenders are exactly alike. Some of these offenders will enter the correctional system with serious mental health needs. Some are elderly and medically fragile. Some are coping with past trauma or victimization, and they have challenges relating to immigration status, sexual orientation, offense type, gender identity, etc. And really the question for this week is pretty simple. Should the correctional systems treat all offenders the same? Now, at first glance, treating everyone equally sounds fair, right? So uniform policies create consistency. They reduce opportunities for favoritism, and they provide clear expectations. And a lot of the public, they want a justice system that treats individuals similarly and avoids what looks to be arbitrary decision making. But that becomes more challenging when we have offenders with dramatically different needs. And we've talked in this semester so far, but think about an elderly inmate who requires extensive medical care. Should they be managed or treated the same way as a healthy 20-year-old offender? Should a woman who's pregnant or who's caring for young children be supervised exactly the same way as a woman without children? Most people recognize that the individuals that we just talked about face unique challenges, but the challenge becomes how we as a correctional system should respond. So one approach, and something we've talked about extensively, is this idea of individualized corrections. So under this model, things like interventions, treatment plans, services provided, they're all tailored to the specific need and risk of each offender. And the goal then is to improve outcomes by recognizing that different people require different services, different approaches. But also, like we've talked about, this does create challenges, right? This requires a lot of resources. It requires a lot of training. There's a lot of discretion in the process, and that can create issues of abuse, that can create problems with public controversy. When we see two offenders treated differently, some people would say, okay, well, that's good because you're giving each offender the care that they need. But other people are going to see it as unfair, inconsistent, or overly lenient. So for example, a veteran may qualify for a specialized treatment program that non-veterans are not eligible for. An offender that has severe mental illness may receive accommodations in a prison setting that aren't available to those without the same mental illness. And the challenge becomes balancing what is fair or versus what is special treatment. So of course, if we don't do an individualized approach, the opposite approach is a blanket model or a standardized model. And under this approach, everyone's subject to the exact same policies, expectations, and consequences. The positive is that this model promotes consistency and it may be easier to administer, but it also becomes inflexible, right? So treating everyone the same doesn't mean that everyone experiences the same treatment. So a policy or a program that works for one population may be ineffective or potentially even harmful for another population. So how do we manage that? What kind of consequences are we willing to live with? As a result, something I've said over and over this semester, correctional systems are often caught between competing pressures. If they individualize responses to each offender, they are criticized for inconsistency. If they standardize responses for each offender, they can be criticized for ignoring important differences and maybe even harming offenders. So the tension appears repeatedly when we examine what we consider to be vulnerable populations in corrections. These are anything where the needs of the offenders are beyond the standard. So mental illness, individuals with depression, anxiety, PTSD, schizophrenia, substance abusers, women in corrections, right? We have a lot more rates of trauma, victimization, caregiving responsibilities. This is not just for females, but if we have any situation where an offender is a primary caregiver for a child, that becomes significant in terms of their actions in the correctional system and also their reentry pathway. And then we've got our aging offenders, right? So let's not forget people like Robert. Longer sentences. We've created this population. We've created this problem. Our mass incarceration policies over the last several decades have created a very large growing population of elderly inmates that are going to require increasing levels of medical care and assistance. And so we have facilities that were never designed for older populations trying to deal with questions about chronic illness, mobility limitations, dementia and Alzheimer's, and just end of life care. Now, correctional systems often rely on broad policies designed to apply to a large group of people. But if every offender enters a system with a unique combination of experiences, strengths, challenges, and needs, it forces our system to move beyond stereotypes and to really examine how correctional policies affect real people rather than hypothetical ones. So as you look through your literature for this week, I want you to really think about the characteristics that make your offender different from the stereotypical offender profile. And several of we've latched on to the most common, right? Robert is old. David is a sex offender. Elena has involvement in gang membership. Sarah has children. These are standard characteristics that we've already talked about, but there are other things, right? Look at their education level. Maybe somebody has a unique higher education. Look at their experiences. Look at their characteristics, their family characteristics, their family needs. How are all of these shaping what they bring into the correctional system, and how their path is going to be a little bit unique compared to the stereotype offender that we encounter more often. So I want you to think about, when you're doing your case analysis, I want you to really think about where your offender fits within this debate. Does the correctional system recognize their unique needs and circumstances? Have we created programs that would help address their unique needs? Or do we just have to treat them like another offender moving through the system? If you were responsible for designing correctional policy, either at an institution or in a reentry setting, how would you balance fairness, consistency, accountability, and individual offender needs? I look forward to hearing your thoughts in class, and I'll see you next week.